Thank you.
Thank you all. You haven't heard me yet, hopefully you can't take that back. I want to start today just a little bit different than I was going to because of something that happened last night. So we got here early last night, and we got to have a get-together with the speakers today and a lot of people you've seen, and then the governor and first lady. And towards the end of the night, the first lady got up and started to tell her story, Catherine. And I'm listening to her story, and out of the corner of my eye, I noticed the governor. It's hard not to notice him. He's got a motorcycle. And so I look over at him, and I'm really good at reading audiences. I know when I have them. I've been in front of so many of them. I'm good at reading people. The look on his face was awe. It was awe. And I thought, man, it was so moving to me because I came to North Dakota and I'm wounded. I'm from Tennessee, and I was going to tell you all, I've listened to a few of y'all talk. You talk funny, all right? And Tuesday night, I was in rural Tennessee trying to advocate to bring addiction treatment into a rural community that's been devastated by the opioid crisis. And I was met with vitriol. I was screamed at. I was yelled at. I was told I was a dope dealer. I was told somebody had looked at my history, and I've been in recovery for a little over 19 years, and they told me that I didn't deserve a medical license. The arrogant side of me wanted to say, I don't only have a license, I'm the vice president of the board. I didn't do that. But those of you in the audience had a little trouble with ego. You know how that goes, right? And I was beat. It was the saddest display of human behavior that I've seen in a really long time. And for those of you, who know anything about civil rights, just think of 1960s era Jim Crow South. And that's what I faced. And so when I landed in Minneapolis yesterday morning, I got me a Diet Coke. I went over in the corner and I cried. It was a really, really tough day, but I knew I was coming to Minot. I hadn't met the governor and the first lady yet, but I knew Jonathan Holt, and I knew my day was going to get a whole lot better. I met Jonathan in D.C. I didn't have anywhere to sit. I picked out him because he had the coolest glasses of anybody I've ever seen. And then Jonathan and I became friends. So guess what I'm going to try to do for you in my talk today is I'm going to try to wrap up what you've seen today. And I'm going to try to tell you about two systems of care that exist in the United States. And I'm going to tell you why the opioid abatement money that we got, that we have received, it's blood money from the lawsuits, needs to be put to good use. And by put to good use, I mean creating a recovery-oriented system of care that no matter where you touch the system, you get the care you need, not the care that somebody provides, all right? And I'm going to do that using three stories. One of them's mine because I'm in recovery. I have lived experience, but mine is a highbrow lived experience. I didn't get addicted until I became a doctor. The first time I used, I was a chief resident. I was getting ready to go out into the world, and I had anxiety and depression and all these things going on. I threw half of a 5 milligram Vicodin in my mouth, and suddenly in about 30 minutes, all my life's problems were solved. It's like a person that struggles with alcohol. They'll tell you, I knew I'd found my answer at the first drink, right? I knew I'd found it at that first pill. Within 4 years, I was using 500 milligrams of OxyContin and 8 milligrams of Xanax a day and seeing patients and working in the ICU and teaching medical students, medical residents, pharmacy students, pharmacy residents. I was doing that every day. And then I had that moment, that cry out, right? I need help. My dad confronted me, and I got to go to treatment. I went to Vanderbilt University in Nashville, which is where I live now. And that's when it started for me. I started to see two systems. Nobody there knew I was a doctor. There were 24 patients on my ward. Do you know how many of those 24 patients got to go to a treatment center when they left 5 days of detox? How many? One. You're looking at him. You're looking at him. And I knew right then, and guys, I'm still in the drug haze. I'm still coming off dope. And I saw it right from the beginning, and I haven't stopped thinking about it. My little neighbor on the floor was a prostitute in Printer's Alley in Nashville. She was wonderful. She had marks on her arms from her intravenous use, and before I left, she brought me a picture. And she said, hey, Steve, I wanted you to see what I look like when I'm clean. Her words, not mine. And I looked at her, she was at her junior prom at Mount Juliet High School. She looked like an angel. I don't go through a day without thinking about her. Not a day. Because she went right back to the street in 5 days. I'm a doctor. I cost too much money to make. The taxpayers of the citizens of the state of Tennessee paid for my education. It's easier to rehabilitate me and put me back in my job. The rest of those kids went right back to the street. And guys, I'm no longer good with that. So I'm going to talk to you today. I told you I'm a Tennessean. I take Tennessee with me wherever I go, not only in the way I talk, all right? I love this, and if you don't take anything away from today as far as I'm concerned, the dope sick thing, that's all great, right? It's good stuff. This stuff I'm going to talk about today is what matters. I'm a Tennessean. Alex Haley, the author, is from Tennessee. He wrote the book Roots, put a miniseries on TV in the 1970s. It was about his family's enslavement in West Tennessee, and Alex himself grew up in Clinton, Tennessee. And so this is Alex's, and I'll have to give him credit for it. But I want you to think of all of us in this room in recovery. We're all this right here. We're a turtle on a fence post. What's the one thing you know looking at that picture? What is it? It damn sure didn't get there by itself. That turtle did not shimmy up that fence post and get there by itself, all right? Everybody in recovery in this room is a turtle on a fence post. You're a turtle on a fence post, and the thing that keeps you on that fence post is the awe he looked at you with last night. That's the deal, guys. All right, so we're going to go with the Stockdale paradox today. I love the Stockdale paradox. The Stockdale paradox says that we're going to confront the most brutal facts of our current reality, whatever they might be, at the same time retaining faith that we're going to prevail in the end regardless of the difficulties. And I believe that we will. So this number right here, Governor has already spilled the beans on this one. I promise I had this talk put together before he said it. So this number on the board is 107,622. It's the last year we have overdose numbers for in the United States. That is equivalent to a 747 fully loaded, crashing and burning every 36 hours in the United States around the clock for a year. And if that was the case, nobody in this room would fly. And yet it goes on in silence. Why? Because of shame and stigma. Because of those people yelling at me the other night in rural Tennessee, because I wanted to hate them, I wanted to fight them, right? I wanted to get all these tenants. We go out in the parking lot, one of us is going to walk away, one of us ain't, right? That doesn't get me anywhere. They've been scarred, they've been hurt by a treatment system that treated them as less than. And I'm telling you guys, when you're under fire, it's hard to remember that in your heart, right? Because the fighting side of me wanted to go after them. But the truth inside of me knew that they were hurting. They were hurting. So, I love the quote below this. Every system is designed perfectly to get the result that it gets. You can't argue with that. So where we are in the U.S. right now, where you are in North Dakota, that is our number. That's what our record is. So let's see what we can do with that. I usually like to show this picture whenever you're eating, but right now we won't. All right, so this is a patient I got in a rural clinic in Cocke County, Tennessee. Cocke County, Tennessee is famous for two things, fighting roosters and moonshine. And it's been devastated by the opioid crisis. I got this young lady in our clinic, and I looked at, and we got her stable on medication. She's doing really, really well. And I checked her everywhere, right, for marks. Always look on arms, right, clavicles, underneath ring bands, underneath watch bands, genitalia, groin, breast, everywhere you could think to look at. I forgot to look at her shin, because I'd never seen anybody inject in their shin. And after she'd been there 2 weeks, she said, Dr. Loyd, I need to talk to you. We went back in my office. I had my nurse with me. She rolled up her pants leg, and this is what I saw. And I said, oh, goodness, honey, you need to be in the hospital. She said, I was in the hospital. I was at a large academic institution, which I shall leave unnamed. It's a teaching institution. She went in there. She'd already had open heart surgery and a heart valve replacement from intravenous use, so they know what her deal is. And they started giving her IV antibiotics. She was using 5 grams of heroin a day. What happened to her after she'd been there for about 24 hours? She got dope sick. Hospital had no idea how to handle the dope sickness and didn't bother to investigate the medications that could help them. This is a teaching hospital. What'd they do to her when she got agitated? Kicked her out. She went back to the street. She has an 11-year-old son that she wants custody of. Does she need her custody of her 11-year-old son right now? No, she doesn't. We need to help her. We need to make her a turtle on a fence post. Okay, she wants her 11-year-old son back. All right, so I said, you need IV antibiotics. She said, I can't get them out here. I said, you need antibiotics by mouth. She says, I'm taking them. I said, what are you taking? She said, Clinda, something. Well, it's clindamycin. That's a good choice for a wound infection. I said, bring it in to me tomorrow. She brought it in, and she was taking clindamycin. And it was in a blue box, and it had fish on it. It was clindamycin for guppies. she had Googled skin infections, she had Googled antibiotics for skin infection, and figured out that she didn't have to put up with the stigma of a doctor's office, and she bought her antibiotics at a pet food store. Guys, we live in the United States of America. We're the richest country in the world, and there's not even really a close second. And it's the healthcare system that our folks step into. And I will guarantee you there are people in this room that have been treated exactly like that. This is my friend Brooke Sargent. I'll tell you this, when I got into addiction medicine, there was two groups of people that I wanted to look at. I wanted to look at pregnant women and people in jail and prison. So again, I'm from the deep south. People in jail and prison, they need to be there. We need to lock them up longer. That's going to solve our problems. Governor's already clearly outlined that. It's helped so much over the years, so we're going to keep doing it. So I know nobody really cared about that, but they cared about pregnant women. Right? They cared about pregnant women. If you ever want to be the expert in a field, pick a field nobody else is in. All right, and that's what I did. And I started treating pregnant women. I heard everything in the world. These women are hurting their kids. They're doing this, they're doing that. And I thought, gosh, what a terrible group of people. And I'm in treatment provider meetings, and I said, okay, what kind of treatment program do you have for them? And I said, we don't take them. And I said, okay, you just said all these things about them, yet you don't provide a treatment program to help them? I said, well, what about if they come in, we're treating them, and they get pregnant? That can happen, right? What do we do then? What do they do? They kick them out. They still do that today, for the most part. So I started treating pregnant women. The two things in medical school I did not want to be. I did not want to be an OBGYN. I used to tell people the placenta used to hit me in the back of the head. I couldn't wait to get out of the room, all right? And I did not want to be a psychiatrist. And my field of expertise became pregnant women. And so I just started reading, and I taught myself. When I left the Haslam administration and went back out into the world, I wanted to go to a place that would let me start a treatment program for pregnant women. This was my second pregnant girl that I got. Her name is Brooke. Her mother took this picture of Brooke before she came to see me. She lives in Ohio. I was in Murfreesboro, Tennessee. It's a 7-hour drive. And Brooke found out she was pregnant with her first child. She was using IV heroin, IV fentanyl, and what else? Methamphetamine. Oh, sorry, didn't mean to do that. Any of that would spoil my difficulties. She's using methamphetamine. That's what the pick marks are. Methamphetamine's made out of stuff you get at Lowe's. Impurities get under your skin, you pick it, and that's what she was doing. She was 8 weeks pregnant. She wanted to do something different. Her and her mother literally went into the computer. They Googled doctors that will take women who are pregnant and using drugs, and my name popped up. I said, bring her. Brooke is the toughest patient that I've ever had in my life. She's a certified welder. I knew Brooke for 2 weeks before she called me anything other than MFer. And I love my Brooke, and she wasn't using the initials, guys. It is what it is. Why was she doing that? She wanted to chase me away. She didn't want me getting close to her, and I don't run. I don't back down. And I hung in there. And we hung in there, and we hung in there. And the good thing about pregnant women is you can scare the hell out of insurance companies with them. So I scared the insurance company every time I talked to them. She's half dead, ain't looking good. I kept her for a long time. I got her at 8 weeks. Pregnancy's 40 weeks. She's 38 weeks in this picture. It's one of my favorite pictures of Brooke. We had her in sober living. She was getting help with her childhood trauma, guys. You got to remember addiction is genetics, trauma, and opportunity. That is addiction. So Steve Loyd, when he was sitting there taking that first hydrocodone, didn't have any idea that his long family history of addiction put him at increased risk to misuse these medications. And Dr. Roy has already told us we don't learn any of this in med school. Everything Lippy taught you this morning, everything we learned on our own. We don't teach it in school. It's the #1 health problem in the United States outside of COVID. So Brooke is Brooke is moving along in her pregnancy, and she's doing so well. She's in sober living. We're starting to deal with her trauma. And I want to go back to my trauma just for a second because I don't want to skip over that because of something the First Lady said earlier today. I had no idea that my history of physical and sexual trauma put me at increased risk to use this. And so I held on to that sexual trauma piece. I didn't let that secret out. And 10 years later, I was on the edge of a bed in my apartment. I was living by myself at the time, looking down the wrong end of a 45 with the hammer back. And I remembered two things. I asked for help, and I was scared of who was going to find me. And guys, just think of the consequences if I pulled the trigger. I didn't pull the trigger. I put it down. I asked for help. And 10 years into recovery, right, I wasn't using, I wasn't drinking, I wasn't doing anything. I was the drug czar of the state of Tennessee. getting ready to take my own life because I did not deal with that sexual trauma. I was going to pull myself up by my bootstraps. That was a long time ago. All the crap that we hear. And now, when I'm in front of audiences that I don't know anybody here outside the people I met last night and Jonathan, it's really important that we deal with trauma. It's really important that we find somebody to help us with those deepest secrets. So Brooke has a trauma history my Sunday school class don't want to know about. We've got people in this room right now that have a child struggling with addiction. And you go to Sunday school and you pray about selling a piece of property. There's nothing wrong about praying for selling a piece of property. Why can't we say, hey, in my family, I've got somebody that's struggling at home and I need help. Why don't we do that? Because we're ashamed and because of stigma. Same reasons those people were yelling at me the other night in rural Tennessee. So Brooke was on a good path, but Brooke wanted to go back to Ohio. What's back in Ohio? Something called a baby daddy. Now, I had no idea what a baby daddy was. You know how when you play like you know something for a while, you get so far down the road you can't tell people you don't know? That's what happened to me, and so I was embarrassed, and all these women kept talking about baby daddies. I got no clue, and so I went on Urban Dictionary and figured out what a baby daddy is, and so now I know. So Brooke wants to go back to Ohio. I want to keep her, and she doesn't have anybody in Ohio that will accept her Medicaid. She's going to have to write a doctor a check or pay him cash, $125 just to simply write her medication every week. It's not going to give her any help with her underlying mental health issues, not going to give her any help with her addiction. And that's what Brooke went back to, and she started to struggle a little bit. She heard her mom, Angie, sent me this from the birthing suite, and I want you to look at Brooke in that picture. 32 weeks. 32 weeks. There to there. Brooke is a dime. Y'all know what a dime is, don't you? She's a 10. Brooke is a 10, but she's struggling because she's got a job as a welder, but she can't get a job as a welder because of something that Doug talked about earlier. She's got 2 felonies. Her felonies were for possession with intent to resell, but she wasn't a dope dealer. She's on fentanyl, so her tolerance gets so high, she needs so much dope that when she gets caught with it, it's more than intent for resale, and she had a public defender. My kid wouldn't have a sticky note in its chart. She didn't have anybody sticking up for her. She's got 2 felonies. She's making minimum wage working at a mini mart. Nothing wrong with that. She can't support her kid. She's giving the doctor all of her money because he doesn't take her Medicaid. This is a system of care that Brooke stepped into. The system of care that Stephen Loyd stepped into has a 95% success rate. 95. I got 95 days of high-quality inpatient treatment. I got 5 years of aftercare and follow-up. I had a 6-figure income. My job paid me every day I was gone. I'd never missed a paycheck. If I don't make it, who's going to make it? And Brooke didn't have any of that. There's 2 systems of care, guys. There's 2 systems of care. There's system of care for people who have money, and there's system of care for everybody else. And we have to use the opioid abatement money to solve that. So, this is the first picture that Brooke sent me after she gave birth to her child, Ava, and it's one of my favorites. And again, Brooke is still looking very dimish, and Ava is Ava. And babies are, what are babies worth? Nothing. They're not worth anything. They pee, they poop, they cost a ton of money, they contribute nothing to the bottom line. They're worth things because they are. Because they are. And somewhere along the line, we all lose that. Because we are, and we get down the line and we think we're worth what we can produce, right? And that's where we separate our true self from our false self when we go down that road, and then usually the only thing that'll fix it's something that fixes our feelings, and a lot of times that's drugs and alcohol. So Brooke is struggling. She starts to have a few slips, and she winds up getting arrested and put in jail, and I'm going to leave her there for just a minute. So who's that character right there? I'm very jealous. I told you, I'm jealous really of 2 things today. One is Scott Davis is really good looking, and the other is Doug's hair. I'm bald, so that's why I have a hat on in case you know. But back then, I missed that hair, by the way. That's me on graduation from medical school back in East Tennessee. That's my wife, Karen, and my 2 best friends from med school, Mike and Michelle McGee. I had always had a problem with drinking. I had no idea that my issue with alcohol put me at increased risk to misuse this medication. None, guys. I had no idea that my physical and sexual abuse, from molestation to rape when I was a kid, put me at increased risk to misuse this medication. No clue, right? And the thing that had kept me sober all through medical school, because I didn't drink, one thing is my classmates voted me their vice president or their president of their class. And I couldn't let them see me like that. What happens at the end of 4 years? Go to the corners of the earth. I was drinking within about 6 months of this picture being taken. This is my little family. That's me, my son Heath, my daughter Haley, and my wife Karen. I'm a perfectly great looking family, right? We look good on the postcard. But if you look really close, in my pocket right here, what's that bulge? It's a bottle of pills. You may be able to think you can see it from the outside, but can you really? If I hadn't have pointed that out, would you have pictured that that guy in there was under the influence of OxyContin and Xanax? Probably not. And that's the nightmare that I lived with for about 4 years. I went to bed half the nights praying I wouldn't die, the other half of the nights praying that I would. I love kids. I've always loved kids. When we go to the beach with our big crew, I'm the guy down in the water with the kids while all the parents sit under umbrellas and drink margaritas. And I'm always with the kids. We were at Disney World, and that's my niece and nephew, my son and daughter, and my 2 goddaughters. And it's the end of a really long day at Disney. I'd promised God if he got me through it, I'd never go back. I went back on that a bunch. It's October of the year, and if you look at me really close, I'm shiny. I'm withdrawing from drugs in that picture. I love that picture. I love those kids in that picture. Some of them got their own kids now. But that is me. We went on a cruise. I got out in the middle of the ocean and ran out of pills. I didn't know I'm getting ready to be dope sick for the next 2 days. This picture hung above the mantle in the Loyd household in East Tennessee for a long time, until about 2 years ago when I walked in at Christmas time. I said, Karen, can we take that picture down? She said, why is that? I said, honey, I'm dope sick in that picture and I can't look at it anymore. That's where I was in my life. But I'm a doctor. I cost too much money to make. I got high quality treatment. I was paid the whole time I was gone. I didn't get disciplinary action on my license, had a way to make a living when I got out. Brooke got put in jail. Brooke had her medication stopped by a jailer with no medical training, no medical license. She had her psychiatric medications stopped by a jailer and allowed to withdraw on the floor for 30 days. And when she got out, she didn't get referral to treatment. Brooke didn't get any of that. Brooke got treated as less than. And guys, that's the system of care we have. And I love the state we're in right now, and I love the people I've got to talk to today. I talked to a peer recovery specialist at lunch. I talked to a man and his wife here today who have a nephew who's struggling. I love the people I've talked to. This is going on in North Dakota today. Guarantee it. Guarantee it. So what happened in my life? It goes up and up and up. I become the director of our residency program. I become the chief of staff for the hospital. I become the chief of medicine. I was the drug czar for the state of Tennessee. I mean, my life didn't do anything but go up. A few years ago, I got a registered letter in the mail. Nothing good comes registered ever, except for this. Our governor, Bill Lee, appointed me to the Tennessee Board of Medical Examiners, and I'm the vice president of the Board of Medical Examiners. Guys, I should be in front of the Tennessee Medical Board, not on it. I'm here because I'm a turtle on a fence post. I'm here because I had people step into my life and love me when I was unlovable and put me where I am. Everybody in recovery has that. Scott Davis got up here and talked about his uncles, Fatty, right? The other uncle that he went up to get ready for the pity potty, and he looked at me now and said, son, you got to make some changes, right? That's a turtle on a fence post, and that's what Steve Loyd is. What happened to my friend Brooke? On the morning of December 13th, 2020, my phone rang. I looked down, and it was Angie, Brooke's mom. She said, Steve, I found Brooke cold and blue in her bed this morning, her childhood bed, by the way. She died of acute drug overdose of heroin and fentanyl. Brooke is one of the 107-622. And you say, okay, fine, we'll kill our way out of this. So she's gone. Not quite, not quite. Who's that on the other side of that picture? That's Ava. Y'all know what ACEs is? Adverse childhood experiences, physical, sexual, emotional abuse. When your ACEs score gets to 4 or above, your risk of just about everything you can think of goes straight up. Diabetes, hypertension, cancer, goes straight up. Mental health, substance use, almost straight up. Let's take a look at Miss Ava. Angie sent me this picture not long ago. Ava is potty training. Right here's her little potty. She seems to be very pleased with whatever has transpired there. I told you addiction is genetics, trauma, and opportunity. Let's look at her genetics. What's her mom? She has substance use disorder secondary to opioids. What about her daddy, the baby daddy, in prison? Substance use disorder secondary to opioids. Her first 7 is on a pay line. I teach it like a slot machine. When the 3 7s come on the pay line, that's when the money comes out the bottom. Her first 7 is on the pay line. What about her trauma? She's never going to know her mom and her dad's incarcerated. She's 2 years old and she has an ACEs score of 2. If we don't intervene on this child, what are the chances she'll be in our system in the next decade? It's almost 100%. And guys, we have to start doing this. We have to start looking at education programs to target these kids who are at increased risk. And we know who they are. We know who they are for sure. How do we know? Ask their damn first grade teacher. They'll tell you who they are. What about Steve Loyd's life? I'm sorry. I'm sorry. Sometimes when you do this, there's people in the audience that connect because they had the same experience, and sometimes it's a trigger. And I know that there's multiple people in the audience right now because I can see all y'all's faces, and I'm so sorry. I'm so sorry. You need to talk to somebody as soon as we're done. This is my family. I'm the first person in my family to ever go to college, let alone medical school and graduate. As a little boy growing up in rural East Tennessee and southern Appalachia, I never dreamed I'd go to Florence, Italy. And I took my family to Florence, Italy a few years ago. That's back in the background, that's the Duomo. That's my son Heath, that's my daughter-in-law Laura, that's my wife Karen, that's me. But I want to spend just a couple of minutes right here. That's my daughter Haley, that's where all my money goes. Every dad in the room knows this. When you have a little girl, somebody at some point is going to come along and take her, right? And I dreaded that day. Now, when Heath left the house, it's time for his ass to go, all right? Haley, I told her if she'll stay in her bedroom the rest of her life, I'll pay for everything for as long as she lives. So when Haley was a junior in high school, she had her first date, and she brought this thing right here home. His name is Sterling, and it was their first date. He was a senior, she was a junior. I was sitting out on the front porch waiting on this kid. He pulled up in a car at my house in a car that there's no way I was going to let him drive my daughter in, so I gave him my car. I didn't know him, and I talked to him for about 5 minutes. I walked into where Karen was, and I said, Karen, I think I just met our son-in-law. She said, come on, Steve. They hadn't even been on their first date yet, and I said, I'm telling you. 6 years later, I'm standing at the end of a long aisle in Charleston, South Carolina, that cost me a fortune, by the way. And I'm getting ready to walk Haley down the aisle, and she's on my right arm, and I'm coming unglued because I don't want Haley to go, no matter how much I love Sterling. And right before we walked down the aisle, she laid her head over on my shoulder, and she said, Daddy, you're the first man I ever loved. Thank you for everything you did for me. Not a bad day. I'm a turtle on a fence post, guys. I wouldn't have been there. At that moment, I knew that in the program that we gave our guests that night, that I was in there and I was not in parentheses. I am still Stephen Loyd, May 11th, 1967 dash. Guys, I'm a dash. I'm a dash because I'm a turtle on a fence post. I stepped into a system of care that was designed to get me better. So the guys in the room that are now looking forward to that moment, let me put a little asterisk by that for this reason. When she gets in the car and goes to a motel with him right after that, that still sucks, okay? Bad. They've been married 6 years. They come to visit us. I want them sleeping in different bedrooms. My son Heath was a baseball player in college. He had all kinds of buddies, all kinds of friends, and he came downstairs during the pandemic. Tennessee only closed down for 1 month in April of 2020, and the pandemic did a couple of good things. One of the really good things it took sports off TV and it brought back the family dinner table. And Heath sat down, and he's getting married in October, and he looked at me and he said, hey, Pops, would you be the best man at my wedding? Yeah. The 2 best days of my life, and now I have 3 because I have a new closing slide. But at the time, the 2 best days of my life, I was present for because somebody stepped into my life with a system of care that put me in Minot, North Dakota right now. Three weeks ago tomorrow, September 15th, 2023. Meet CC. CC is my first grandchild. So when I stand in rural Tennessee the other day, listening at people hurl the hatred they hurled at me, this is the stuff I got to think about. I got to think about what I know is possible. I'm not smarter than anybody else. I had more resources, and I stepped into a system of care that was designed to put me right here. Guys, all of us in recovery and all the people that want to be in recovery, we're turtles on a fence post. Thank you.